Clinical researchers, I'm about to leave for the day, but I wanted to talk to you guys about consenting, informed consents. Not what that is, because I've done videos on that in the past, but if you're a site or if you're a monitor, having consenting issues is actually a serious thing, because those are usually, most of the time, IRB reportable, and it's a deviation. Okay, so you have to follow your site's SOP. If your SOP states you're going to date and initial the bottom of every page, the subject dating and initialing, and they don't do it, okay, that's not necessarily a GCP requirement, but if it's in your SOPs and you don't do it, an auditor is going to take issues with that. Same thing with whether you're using electronic or paper, okay? You can't usually combine these things. It has to be one or the other. So if you're a new site, a new coordinator, an inexperienced coordinator, make sure you're following your site's SOPs, okay? And first of all, make sure that those SOPs are compliant with GCP. It's in the CFR, Code of Federal Regulations for Consenting. It's pretty vague, so make your SOPs accordingly. But you got to follow your SOPs, and no, you can't revise your SOPs after your site initiation visit without the sponsor approving it, because what they collect at your site selection visit is a copy of your process of consent. So if you realize later, hey, we didn't follow our SOPs, we'll just revise our SOP, you can't do that. The sponsor has to approve it. So be careful with these kind of things. They could really hurt you, and it doesn't seem like a big deal, but they are.